Good morning. This is week 9 APU pre-conference for 4th semester APU students. We will discuss HESI prep, types of HESI exams, what the test is looking at, how it relates to the NCLEX, why studying matters, and some resources as well. Okay, so HESI, it actually stands for Health Education Systems Incorporated. It's a series of standardized nursing exams that were created by Elsevier, which you guys use, to evaluate nursing students' knowledge, critical thinking, and readiness for the NCLEX licensure exam. For the purpose of the exam, it does help nursing schools assess how well students are learning their course material and their curriculum. It will identify strengths and weaknesses early of students as you progress through nursing school. And then faculty can prepare more students more effectively for the NCLEX based off of the HESI exams. So as you know, there are different types of HESI exams. They have their admission test, which is called the A2. This is taken before you get to nursing school. This tests academic readiness, reading comprehension, math, vocabulary, grammar, and anatomy and physiology. You have your HESI specialty exams, which are taken while you're in school. So that's fundamentals, med-surg, pharmacology, pediatrics, maternity. This will evaluate your mastery of specific course content and patient populations. And then finally, you have the exit HESI exam, which is taken at the end of the nursing program. This will predict how likely you are to pass the NCLEX on your first attempt. So many schools do require a certain HESI exit score, often 850 or higher, before graduation or before allowing NCLEX registration. So for content areas like the NCLEX, the HESI does cover safe and effective care environment, health promotion and maintenance, psychosocial integrity, physiological integrity, including pharmacologic and parental therapy, such as medications, IVs, therapy, and dosage calculations. I often say, if you've had me before in clinical, you know, if you're not a safe nurse, you're not going to pass the HESI. It's that simple. If you change your answers, you're not going to pass the HESI. If you second guess yourself, you're not going to pass the HESI. The HESI is a very standardized test. It is not there to trick you. There are no trick questions. Do not pull in outside information. That's my best advice to give you. So the HESI exit exam, it does mirror the NCLEX in format and difficulty. Performing well in the HESI indicates that you're likely to pass your NCLEX on your first try. So that is the goal, is to test within 3 months of graduation and to pass on the first try, okay? It is a great practice run for NGN style questions, case-based and clinical decision scenarios. So this matters because many schools do require a passing HESI exit score to graduate or to be cleared for NCLEX registration. It also will help you identify weak areas so you can make your test plan, maybe studying your weaker areas first, so especially medications, prioritization, safety, and nursing interventions. So your test plan, next-gen NCLEX test plan and pharmacology emphasis is structured around client needs. So are you using safe and effective care in an appropriate environment, health promotion and maintenance, psychosocial integrity, physiological integrity, which includes pharmacological and parental therapies. Pharmacology appears significantly in physiological integrity because safe medication administration is very core to nursing. Your NGN, next-gen NCLEX uses new item types such as case studies, multiple responses, matrix, requiring you to recognize cues, analyzing data, prioritizing hypotheses, generating solutions, taking action, evaluate outcomes. Does this sound familiar? Hint, hint, your weekly concept maps. What that means for pharmacology, you aren't just asking what drug, but likely you're going to be saying, given this patient scenario with labs, vitals, meds, what is a priority nursing action? What monitoring, what teaching, what drug if needed? So your HESI exit exam and other HESI specialty exams that you have taken are used by nursing schools to gauge whether students are ready for NCLEX and safe clinical practice. It does cover areas, again, like fundamentals, health assessment, pharmacology, medication, psych, via Elsevier's HESI materials. So you should be studying the company's materials because they write the exam. If you perform well in HESI, especially pharmacology and nursing interventions, you're more likely to succeed on the NCLEX because you've built the foundational knowledge and clinical judgment skills. So for this pre-conference, you're going to treat HESI preparation and NGN preparation as aligned. Better med knowledge plus better nursing adventures will give you a stronger outcome on both. For medication pharmacology, your must-knows for NGN and HESI, you're going to focus on high-yield drug classes, for example, cardiac meds, diabetic patients, testing on their insulin, pain medications, especially opioids, anticoagulants, ACE inhibitors, beta blockers, calcium channel blockers, etc. Because they appear often in scenario-based testing. For each drug, you must know the mechanism of action, common adverse effects, contraindications, nursing implications, patient teaching, and monitoring parameters. In NGN and HESI, you'll likely face items such as the patient on this cardiac drug has vital sign labs shown as above. What is your priority nursing intervention? Or what teaching point must you give? So, for example, if you have a patient on an anticoagulant, you're going to monitor INR and PT. We've been saying that a lot. You also should know the reversal agent. You are going to tell them to watch for bleeding signs. You need to know what those bleeding signs are. You're going to teach the patient to avoid certain herbal foods, and you're going to tell them what those foods are. And you're going to tell them to hold before procedures, and you're also going to know the education of why we hold it before procedures, and you're going to ensure that the dosage is correct. And you need to know what happens when it is subtherapeutic and supratherapeutic. So link all of this information, nursing interventions and education, so you're not just memorizing meds, but actually applying them as well. For your nursing interventions and patient education, for every medication scenario, you should ask what cues, so vitals, labs, patient symptoms, tell me something that is happening, right? Think of me in your brain when you're taking that exam. Think of me saying, why? What nursing action intervention is indicated, monitoring, side effect mitigation, contraindication checks, what patient teaching is required, what patients must know, behaviors to avoid, how to take medication, how do I evaluate the outcome, what signs, vitals, labs reflect effectiveness of complication. Applying this means in HESI or NGN, you might be asked which teaching point is most important. Or I could ask you, which cue requires a nurse to intervene? So I always say, if you have two patients and they want you to know which patient you should go see first, you need to ask yourself, if I leave patient A, is patient B going to be, or if I leave patient A, is patient A going to be okay? Or if I go see B first, is A going to take on me, right? So you need to ask yourself, which one, if I don't address right away, is going to deteriorate faster? So, for example, if you have a patient that's on a beta blocker or has a heart rate of 48 beats per minute and dizziness after getting up, nursing interventions would be to hold the drug, notify the provider. You want to monitor for orthostatic blood pressure, heart rate, and you want to know how to take them and how many minutes and what is indicative of orthostatic blood pressure and heart rate. Teach patient about orthostatic hypotension. And place emphasis on nursing interventions and patient education are just as crucial as knowing the drug as well. So some study strategies, aligning HESI in the next gen NCLEX for medication mastery. So you're going to use practice questions from HESI and review materials, especially pharmacology and fundamentals, to build your base. There are many HESI resources available to help you with knowledge, recall, and application. I wouldn't use other websites other than like Elsevier and HESI. So use what's available to you. You also need to pull up your remediation report if you've already taken HESIs from the last HESI to see where your weak areas are. You're going to shift to NGN style practice, case studies, alternate formats, scenario-based med questions, priority interventions, and teaching. You're going to build a medication cheat sheet for each drug class, mechanism, adverse effects, nursing interventions, teaching, monitoring, and then you can use flashcards or buy them off Amazon because as a nursing student you're very busy, you don't have a lot of time, and the holidays are coming up. That's what I did. But you're going to integrate that into scenario-based questions. So make sure you're practicing clinical judgment mode. So give a scenario, lab values, vitals, meds. Ask yourself the 6 CJMM steps. So cues, data, hypothesis, solutions, actions, and evaluate. For time management, both the HESI and NGN require you to answer carefully but efficiently. So practice under time pressure and review rationales thoroughly. And also wrapping up, once you master your meds and nursing interventions plus scenario thinking, you'll be well prepared for your NCLEX and NGN, and also the HESI or any HESIs that you have to take. And most importantly, you'll be a safe nurse. Thank you for listening to me talk about HESI. I did take the exit HESI, did well on it, so hopefully this will make sense. If you need any other resources or have any other questions about exit HESI, please let me know. Otherwise, I will see you this week. I hope you guys have a great weekend. See you Wednesday.